Wednesday, April 17, 2013. Though head and neck cancer is relatively rare, the devastation that comes with the disease is difficult to ignore. Removing tumors in the mouth, throat, voice box, nasal cavity, or salivary glands can cause a patient to lose his ability to speak, swallow, eat, or breathe, vastly impacting his quality of life even after the cancer is gone. Patients and doctors have long been faced with the tough decision to follow through with risky treatments for the sake of survival, a challenge that film critic Roger Ebert knew all too well. Before Ebert's death, his head and neck cancer treatments cost him his ability to eat and speak. Over recent decades, radiation therapies have become more effective for treating a variety of cancers. But while these therapies can have a significant impact on a patient's prognosis, they may be too aggressive for head and neck cancer. Because radiation typically targets large surfaces of the body, healthy tissue in addition to cancerous, the treatments can cause serious permanent damage to parts of the head and neck. But recent advancements in radiation oncology may soon change this. At MD Anderson Cancer Treatment Center in Houston, Texas, radiation oncologists have worked over the past several years to harness the precision of proton therapy, a type of external beam particle radiation therapy, in which protons are directed specifically at tumors to eradicate them. MD Anderson's Proton Therapy Center opened in 2006, and currently is one of only 10 centers of its kind in the United States. The therapy's precision effectively attacks complex tumors that are inoperable or otherwise difficult to treat. There's the spray paint approach. And there's the pencil approach where you can put little dots and cover the canvas, said Stephen Frank, MD, Associate Professor at MD Anderson's Department of Radiation Oncology and Director of Advanced Technologies at the Proton Therapy Center. Dr. Frank uses a specific type of proton therapy on head and neck cancer patients, known as intensity-modulated proton therapy, IMPT, which is the most advanced of its kind. MD Anderson was the first center in the world that treated head and neck cancer patients with IMPT using multi-field optimization, MFO, which is a more advanced form of pencil beam therapy that delivers a single narrow proton beam to the tumor. The novelty of the therapy today is we can deliver small spots as the radiation shoots out of the machine. It's the accumulation of these small spots that targets the tumor. To treat head and neck cancer, doctors typically use a variety of radiation therapies that include intensity-modulated radiation therapy, IMRT, which provides three-dimensional imaging. In rare circumstances, doctors may use internal radiation therapy, known as brachytherapy, which involves surgically implanting radioactive material in tumors and surrounding tissue to kill cancer cells. But unlike these treatments, IMPT doesn't penetrate tissue beyond the cancer. Frank and his team have used IMPT to treat patients with tumors in the nasal, sinus and oral cavities, the larynx, base of the skull and spine, and even cancers in the eyes. MD Anderson first used IMPT in 2010 to treat a patient with a life-threatening cancerous mass wrapped around the brainstem. The technology has also been shown effective on pediatric patients with complex tumors, because it's often too risky to treat children's bodies with the aggressive therapies used on adults. To date, the hospital has used IMPT on 130 head and neck cancer patients. Frank's early success with the technology has prompted a more aggressive outreach with patients. This summer, he will begin a randomized control trial of 360 head and neck cancer patients over a period of 2 years. Half will receive IMRT and the other half will receive IMPT. The primary goal of the study will be to reduce higher long-term complications of treatment by 33%, said Frank, who is currently applying for funding from the National Institutes of Health. However, there are some experts who are skeptical, or at least want more information. Len Lichtenfeld, MD, Deputy Chief Medical Officer at the American Cancer Society, said he believes it's still too early to know for sure if this type of therapy will make a long-term difference for head and neck cancer patients, though he said proton therapy has become one of the standards in care for pediatric brain and spinal cancer. What they're basically saying is they can paint the tumor much more precisely, but it takes time to demonstrate that theory, he said. It has generally been accepted by physicians and patients that proton therapy offers a superior treatment, but also, that it has not yet been proven as a runaway successful treatment. Treating patients for a rare, complex illness. Head and neck cancer accounts for only about 3% of all cancers in the United States, according to the National Cancer Institute. Journal Oncology estimates that each year, approximately 50,000 Americans are diagnosed with head and neck cancer, and 11,000 die of the disease. The time most are diagnosed, their cancer has already metastasized. Such was the case for Steve Harris. In November 2011, Harris discovered a lump on the right side of his neck that made it difficult for him to swallow, and shortly after, he learned he had several squamous cell carcinomas in his mouth, one near his tongue, another on his tonsils, and yet another in the back of his throat. After finishing an aggressive course of chemotherapy, Harris still needed treatment. His doctors said surgery was the absolute last resort, and so Harris and his wife began researching his options for radiation therapy. "There's a lot of stuff you can do damage to. That's the reason I decided to do proton," said Harris, who works as a public school superintendent and lives on a 50-acre farm in Wichita Falls, Texas, with his wife and 4 children.